Hello, everyone, and welcome to the National Kidney Foundation's Eve of Giving. My name is Michelle Toy, and I'm the Executive Director for our local office. Everyone gathered here tonight in this new virtual setting has one thing in common. We are all passionate about kidney health, and we all stand united by a desire, an imperative, to provide all kidney patients and their families with access to the quality care, treatment, guidance, and hope they need, especially during these unprecedented times. So thank you for believing in a healthier future. There have been so many changes to our daily lives this year. Virtual gatherings like tonight's event are part of our new normal, and we're not alone. More importantly, kidney patients are also living a new normal. Every day, they live in fear of the unparalleled threat to their health and safety due to their heightened risk of contracting COVID, and how that devastating diagnosis could be to their already Herculean task of fighting kidney disease. So we thank you for maintaining your commitment to kidney patients and to our organization at such a critical moment for our mission. And now, because of COVID, for a whole new population of kidney disease patients. The virus has left hospitalized COVID-19 patients with permanent kidney damage, often requiring emergency dialysis treatment to stay alive. COVID-19 patients are becoming kidney disease patients. So our work and your support have taken on a whole new meaning and even more heightened level of importance. Your participation tonight will allow the National Kidney Foundation to continue working around the clock to ensure that patients and their caregivers have the resources they need to stay safe and healthy. And we are truly humbled by your support to our community. And now I welcome Michael Cohen, who will kick off tonight's festivities. Michael?
Thank you, Michelle, and thank you to everyone for tuning in. My name is Michael Cohen, and I will be your host for tonight's event. Normally at this time, I would be imploring all of you to grab a drink and head over to your tables so we could begin the evening's festivities. But this year is obviously going to be a little bit different. So instead tonight, I will ask that you all get comfortable. If you're like me, that means grabbing your favorite pair of sweatpants and slippers, which I have on, and we've all gotten used to business on the top and party on the bottom, haven't we? And prepare yourself for an inspirational evening, during which you will hear from our incredible honorees. And of course, learn the almost unbelievable story of one family's journey from the depths of dire illness to the elation of receiving a kidney transplant. I promise you, it truly is an evening of celebration and inspiration. But before we start, I would like to take a moment to recognize National Kidney Foundation's wonderful board of directors. Thank you all for your ongoing support, for your dedication, and for your tireless work on behalf of NKF, as well as on behalf of those individuals and families impacted by kidney disease. I also very much would like to recognize and to thank our incredibly generous sponsors. I know that my words will fall short in expressing how truly grateful we are for all you've done. But I really hope you understand how deeply and how sincerely we appreciate your unhesitating and unwavering support of this event and all you do to fight against kidney disease. Everyone present this evening understands that none of our efforts could reach the levels of success without the unmatched dedication of our sponsors. And to all of you, on behalf of all of us, I say thank you. Friends, as we sit here tonight, still in the midst of the deadliest pandemic ever to strike the United States, now more than ever, your support and the support from donors watching tonight's program is absolutely crucial. A new report shows us that people hospitalized with COVID-19 are at significant risk of acute kidney injury, which, as we know, can lead to serious illness, to dialysis, and even to death. COVID-19 is daily creating new kidney patients around the country and as a result, expanding NKF's mission. It's safe to say the kidney patients need us, all of us, now more than ever. But COVID's impact on our population goes beyond just a call for general need. A study completed in June revealed that Black Americans and Hispanic Americans accounted for more than 50% of all coronavirus infections. People of color disproportionately are suffering the effects of COVID-19 as a result of discrimination, socioeconomic inequity, and unchecked racism. These systemic and tragic inequalities massively impact our kidney community as well. In fact, on average, Black transplant candidates wait significantly longer than white transplant candidates for kidney, for heart, for lung transplants. Addressing these health disparities is critically important to our mission and is necessary to help heal and to help save lives in our communities and to affect change in a more meaningful and substantial way. NKF has joined with Donate Life and other national nonprofits in promoting National Minority Donor Awareness Month via our social and traditional channels. Your support tonight will help us spread this important message and raise funds for vital patient education programming in these otherwise underserved communities. It also will help us continue to advocate for minority communities and for kidney patients to receive priority in testing, contact tracing, vaccinations, and funding. We ask that you keep all of that in mind while enjoying tonight's program, and we hope you will consider all of these factors in supporting our mission. And now, I would love to continue the program by introducing our first honor of the evening. The Leadership in Business Award annually is given to those who go above and beyond in serving our kidney community. This year, we are thrilled to present Marcor with this prestigious award. Marcor is a global company dedicated to delivering innovative infection prevention products and services for patients, caregivers, and other healthcare providers, all of which improve outcomes and which help save lives. Marcor has been a faithful supporter to the National Kidney Foundation for over 10 years. Their creative fundraisers, as well as their commitment to kidney patients, make partnering with them a humbling and rewarding experience. Ladies and gentlemen, I am thrilled to present the Leadership in Business Award to Marcor.
For our local office, we got involved with NKF back in 2011 when we signed on for the Lehigh Valley Kidney Walk. We started our sponsorship with NKF at that time. We liked the charitable marketing tactic, thereby supporting our customers, which are dialysis providers, clinics, and hospitals. And the online visibility was part of that partnering aspect. Plus, it afforded us a platform to give back to our local community. And so when we discovered we could do more with the on-site presence at the walk, we basically assembled a team, we had a booth, and we decided to become more active the following year. Some of the different unique fundraising ideas that we came up with, I can think of a handful that we did. We really started off very low key. But as we got more involved, we tried to build in other aspects seemingly every year to see how we could improve. First was pretty simple. We just creating an awareness platform about the event itself and having a team. We ended up calling ourselves Marcor Marchers. The walks became this one-day team building event, something outside the office, something outside the shop. And it really created some fun, some excitement, and we sent probably nearly everybody home with some kind of a gift. Everybody was a winner that night. And so I'm certainly so appreciative and so proud of the individuals who volunteered their time, their energy, their resources to help make our walks and our participation with NKF just a huge success. And this actually carried over into other regions. We ended up challenging other offices to friendly competition. This past year, it blossomed into our parent company, Cantel Medical, doing even more by fundraising And one of the things they did this year was a boss pie in the face contest. And so that brought in some more fun and excitement, and created a way to generate a few more dollars as well. It's certainly been an enjoyable experience working with NKF over the years, and hopefully we can continue to work together in the days ahead. The culture of NKF and their mission, and in regards to how that ties in really neatly with MarCore's mission and culture, it goes without saying, it's also a reflection of leadership, demonstrating that day in and day out, allowing this type of involvement and care to flourish and thrive within our organization. So I'd say it's definitely a culture where people care about their jobs, they care about their teammates, they care about each other, they care about their customers, they take pride in their work and wanting to make a difference each and every day. And so I see some real similarities between the two organizations, and certainly proud to have partnered with NKF all these years.
And now, accepting the Leadership in Business Award on behalf of MarCore is Mike Vergoldi.
Well, thank you very much. On behalf of MarCore Purification and all of the individuals who have worked so hard each and every year to make our walks successful, and who created excitement and fun around these events, giving of their time and resources, we are truly humbled and honored to accept the National Kidney Foundation Leadership in Business Award for 2021.
Thank you, Mike. What an amazing partnership and an incredible collaborator with NKF. We truly are privileged to be able to call MarCore a partner and a friend. At NKF, our dedicated volunteers are an absolutely critical part of who we are, of what we do, and of how we do it. From program delivery to advocacy and event execution, they truly make it possible to carry out our mission. I'm honored tonight to present the Arthur P. Pasquarella Leadership in Action Award. This award is named for our longtime board member, partner, and friend, Art Pasquarella. The recipient of this award embodies Art's uniquely generous spirit, his dedication to patients and to families, and his uncompromising vision of a world without chronic kidney disease. Under his leadership, as past national board chair, NKF has developed innovative approaches to preventative healthcare and focused the organization on patient-centered research, removing barriers to kidney transplantation and increasing public awareness of the importance of kidney health. We are truly lucky to have one such extraordinary leader serving as our local board chair. Tony Nacarato's actions and commitment to the Eastern Pennsylvania, New Jersey kidney community truly epitomize Art's incredible example of altruism and his belief in the importance of our work. This is no ordinary award, and Tony is no ordinary volunteer. Ladies and gentlemen, this year's Arthur P. Pasquarella Leadership in Action Award recipient, Tony Nacarato.
My personal connection to kidney disease is through my brother-in-law, my wife's brother, Thomas. Thomas is a chronic kidney disease patient who is on dialysis and has been so for the past several years. Unfortunately, right now, Thomas is in the hospital battling the effects of COVID-19. So it hits home even more. He's having actually tremendous difficulty with his dialysis and his potassium levels right now. Chronic kidney disease was a problem before COVID, and I think it's going to be even more of an issue that requires our attention as a result of COVID. And I think we're only just beginning to understand, how COVID has made chronic kidney disease and the patients who are suffering with it potentially even more at risk for greater health problems. After serving on the golf committee for a couple years and seeing all of the wonderful work the NKF was doing here in our community, I decided that I wanted to do more and therefore joined the board of directors here in Eastern Pennsylvania. I realized that this was an organization that I wanted to be more involved with and help them to realize their mission and their goals of ultimately curing this terrible disease, but most importantly, caring for patients, providing outreach, providing services, and really uplifting this community, not only those that are on dialysis, but also those that ultimately can have the amazing gift of transplant. What I enjoy most about serving as our board chair is working with the great people who make up our board. We have a great cross-section of business professionals, medical professionals, people who are directly affected by kidney disease, and the passion and the commitment to the board and to the mission of the NKF is really what inspires me. The accomplishments I'm most proud of, I guess, still go back to golf. I'm really proud of the golf committee and all the work that they've done over the last few years to make the tournament so successful and raising some really significant monies to enable our programs to continue. I'm also very proud of the fact that we're recognizing our mission to expand into New Jersey. I'm proud of the efforts that we're putting forward to set up committees in North Jersey and Central Jersey and South Jersey to make absolutely certain that we are doing everything we can for the people in these communities. Receiving the Art Pasquarella Leadership Award is such an honor. Art has been a friend, a client for many years, and to see everything that Art has done and continues to do in the fight against chronic kidney disease is so inspiring.
A leader is somebody who can inspire others. And Tony Naccarato, for years, has been inspiring all of us who are associated with the NKF to work even harder on behalf of the kidney community. He's passionate, he's a good listener, he's always positive, and I just wanted to congratulate Tony Naccarato on being the recipient of the Arthur Pasquarella Leadership in Action Award. It is well deserved.
What's up, my Taccone brother? I just wanted to wish you the best of luck. Congratulations. I wore my orange for you today, and I really hope to see you soon at the ballpark. Congrats, my friend.
Congratulations, Tony, and thank you. Thank you for your service, the leadership of our board, and everything that you do that truly exemplifies what this award stands for, and helping advance the care for kidney patients and awareness for kidney disease.
Tony, just want to congratulate you for the great work that you've done for the NKF these last 3 years, and for that matter, since you joined the board all the way back in October of 2013. It's been a really great run with you. I look forward to continuing to work with you, and thanks again.
Please welcome to your screen, Tony Naccarato.
Thank you very much for this incredible honor. I would be remiss if I didn't thank my fellow board members first, for it is you who have kept me inspired during my 2 years as your chair. I also want to thank Michelle Toy, Jamie Cohen, and the entire NKF staff. You are truly the glue that keeps us all working together. And last but not least, I'd like to thank my friend and client, Art Pasquarella, who truly is the inspiration and the leader for all of us here at NKF. To receive this award named after him is truly my honor. Thank you all.
Thank you, Tony, and congratulations on this incredible and well-deserved honor. The National Kidney Foundation is fortunate to partner with countless strong and compassionate medical professionals and caregivers who work tirelessly to improve the lives of the 37 million Americans impacted by kidney disease. This year, we're honoring 2 members of the medical community who truly embody this mission with our Excellence in Care Award. I'm proud to announce our first honoree is Dr. Ellie Kelliporis. Dr. Kelliporis is a professor of medicine at the University of Pennsylvania's Perelman School of Medicine in Philadelphia. She has over 45 years of experience and has served on our local board in some capacity for over 30 years. Dr. Kalapouris has touched the lives of so many kidney patients and has done so with an unwavering kindness and commitment. It is truly my honor to present the Excellence of Care Award to Dr. Ellie Kalapouris.
I've been involved with the National Kidney Foundation for over 30 years. It's been one of the highlights of my career as a nephrologist and as a care provider. I was first introduced to the National Kidney Foundation when I was a fellow learning my craft at the University of Pennsylvania in Philadelphia. I applied for a grant from the National Kidney Foundation, and I realized how lucky I was and how grateful I am to this organization. Not because they set me on my path to my career as a nephrologist, but because they created a community for me within the National Kidney Foundation where I could be a volunteer, I could be a physician, and I could really connect with patients and connect with the society which they created. Fellowship training is really critically important to the development of our future colleagues. And one of the basic tenets of becoming a nephrologist is a good foundation in education and networking. With colleagues, we created the Mid-Atlantic Fellows Forum, and this was sponsored by the National Kidney Foundation shortly after its inception. And it's more than education, though. It really represents creating a community around the National Kidney Foundation, a networking community, so that our young colleagues understand that being a nephrologist, being a physician, is not just taking care of the patients you see, but taking care of the community at large. The NKF has spearheaded many programs, not only in the city of Philadelphia, the Mid-Atlantic area, but really around the country, and international programs as well. We were the first NKF hub that piloted the Keep Screening program. That revolutionized really the outreach to the community. The community which we serve, particularly in the Philadelphia area, is inopportune because they really have some areas very poor access to care. So the Keep Screening is something that I'm very proud of being a part of. And our first screening in Philadelphia, which was I think almost 20 years ago, we screened 600 patients, and it was wonderful. It was a wonderful experience. I was a fellow when I joined the board of the National Kidney Foundation. And so I joined a board where really I was not only the youngest member of the board, but the least experienced in terms of fundraising and leadership. And actually, I've served on the National Kidney Foundation board for the last, I'd say, 25, 30 years. And what I learned from this relationship was really how to sit at the table and have your voice heard on behalf of patients. It has been a long experience. It has been really a very exciting time as we evolved. Kidney disease is a universal disease, and it affects many patients from many walks of life. It's not a very forgiving disease. It really devastates families. And there are millions of patients with chronic kidney disease in the United States and the world, which really need our help. We are really working very hard to expand the treatment modalities that we have for kidney patients afflicted with kidney disease. So we have to be mindful of how we care for patients at every stage of their disease. This pandemic has particularly affected patients with predisposition for kidney disease. It has really revolutionized and galvanized the physicians to move swiftly to care for patients with COVID. The virus is a very unforgiving virus, and we've seen that patients develop devastating illnesses, not only in their lungs but in their kidneys. We were unable to keep up with the dialysis requirements in the acute setting. We moved together as a society and an organization in order to supply the equipment necessary to keep those patients alive. We were not always successful, and we witnessed patients dying without their families, patients saying goodbye to their family members on my cell phone, literally. And the consequences of this disease are really long lasting. Patients who do have kidney damage, most of them, not all of them, most of them go on to chronic kidney disease and require ultimately either intervention with dialysis or hopefully with transplantation. So we still have very sick patients being admitted to the hospital with really devastating illnesses. It reminded me of the HIV epidemic where patients came in the morning and they died the next day. It was a very similar trajectory, and it really, as a physician, it kind of centers you. And it tests your resilience, and it really tests your ability to just move ahead regardless of any dangers to your own personal life as a frontline worker. And I think we are a stronger medical community because of that. The part of being a nephrologist, which has been the most rewarding to me, is my connection with my patients. I mean that sincerely. I love seeing my patients. I love taking care of them. And one of the things that really makes nephrology, I think, the best specialty in the world is the fact that you can take care of patients for decades of their lives, and you get to know their families, you get to know their children, you get to know when their children get married. And really, it's just a complete specialty. And that's one of the reasons I chose nephrology, if not the reason. So the patients really are at the center of my mind when I'm in the hospital, when I'm in the clinic. And so in addition to just being their healthcare provider, I've become their friend. They've become my friends.
I ask you all, please welcome Dr. Kalliporis.
I would like to thank the National Kidney Foundation for honoring me with the Excellence in Care Award. I'm deeply moved. I'm grateful. I'm also very humbled by this award. I've been a volunteer for this organization for over 30 years, since I was a fellow in training. I was given the opportunity to continue my career as a nephrologist and as a clinical scientist. Because of seed funding from the National Kidney Foundation, I will be forever grateful for this opportunity. And although tonight's Giving and Honor Night is to celebrate our heroes, I really believe that the true heroes in my journey as a nephrologist have been the patients. I have I am in awe really of their grace, their dignity, their resilience, how they bounce back from disease. And I'm so honored to represent them tonight, and I accept this award on their behalf. I would like to thank my family for their support. I missed events from my children. I was always, I worked when I had to. I took care of patients because I wanted to. And I'm really grateful for their love and support over the last 20 or 30 years. I also want to end by thanking the National Kidney Foundation for making this event possible, and for all of you who are attending and who are making donations, both of your time and of your money, in order for us to move all these initiatives from aspirational to fundamental. So thank you very much, and have a great night.
Thank you so much, Dr. Kalliporis. Your dedication and compassion to your patients and their families, it truly is inspiring. I know I speak for so many when I say, thank you. Thank you for all that you do for the kidney community. As you just heard in the last video, now more than ever, our doctors put the lives of their patients ahead of their own. They truly are. on the front lines, dealing not only with the devastating effects of kidney disease, but also with the impact that COVID has had on kidney patients. At times, they are the only ones in the room with their patients as they say goodbye to their families. Can you even imagine? Doctors have taken on new challenges during this pandemic, and it is their strength, their decency, their humility that we are celebrating tonight. Please keep that in mind when we ask you to be generous with our mission moment. Our community needs your support now more than ever. Making a donation is as easy as clicking a button on the left side of your screen. If you are not registered with us on GiveSmart, please text one word, Eve of Giving, to 76278. Once again, if you are not already registered with us on GiveSmart, I ask you that you text Eve of Giving to 76278. I mentioned a moment ago that this year we are fortunate enough to honor two healthcare heroes with our Excellence in Care Award. To her patients, Dr. Susan Conley truly is a hero. Dr. Conley is a pediatric nephrologist at St. Christopher's Hospital in Philadelphia. With over 48 years of experience specializing in pediatric nephrology, Dr. Conley has touched and in a meaningful way changed the lives of countless children suffering from kidney disease. As you will see in the next video, Dr. Conley's impact on the kids she treats is as big as her heart. And while she doesn't wear a cape, her heroism is palpable. We are truly privileged to give this Excellence in Care Award to Dr. Susan Conley.
I think I've been working in pediatric nephrology forever. I have been here in Philadelphia at St. Christopher's Hospital for Children for 23 and a half years, long time. I got into it because I always knew I wanted to do pediatrics. That was never a question. I wanted to be a pediatrician because I really do love children and, find them entertaining and fun and genuine. We see a lot of children with kidney diseases who get better, which is wonderful. We see an array of different diseases and conditions. So we see a group of children who have birth defects that affect the kidneys or the bladder, and then the bladder affects the kidneys. And often those children, as they grow, their kidneys, they may not grow with them as they should, so then relatively their kidney function is decreasing. And then we see children who have acquired kidney diseases. We see the beginnings of kidney disease from diabetes often in children, and we if we start to treat that early, we can often keep that from advancing. In pediatrics, it's very much a teamwork between the medical team and the parents and the child for the child to get better. I think one of the most rewarding areas going through my career has been transplantation. People ask me about transplantation. One thing they say, well, you transplant children who are little. How do you do it? And frequently the answer is because we don't have that many little kidneys available. Our surgeons have become good at putting adult-sized organs even in 20-pound children. Having a very ill child get better is always rewarding. Having a child, him or herself, tell you thanking is, just a moment to be cherished. At the very beginning of the COVID pandemic, we had a father traveled overseas and came back with COVID. It was early on. It was kind of before he really knew a lot about it. So he came back with COVID and he gave it to his 3 daughters, all 3 of them. They all came in the hospital. They were all very ill. They all survived. It was an incredible big team effort. One of the girls was so sick that she had to go on ECMO and dialysis combined. ECMO's a heart-lung machine when your heart's not pumping well enough and your lungs aren't oxygenating. And it's the same kind of machine that you use for heart surgery when you just stop the heart and bypass it, only we don't stop it. We're just helping it because it's not doing its job even close. So she was on ECMO for days, didn't have kidney function, was on dialysis, connected to the ECMO machine. And her sisters were pretty ill, but less ill, and they all three survived. And the last I knew, were doing well. And that was, I would say, just about a whole St. Crest effort. And that's always rewarding when the whole big team of all of us comes together, you know.
Accepting the Excellence in Care Award, Dr. Susan Conley.
When I learned that I was going to be getting this award, at first I was taken aback. Really, me? But then I thought, well, I have done a fair amount through the years, but mainly I've just done what a good pediatric nephrologist does. And I feel like this is an award that should be shared with my colleagues across the country, because I think that we all are very hardworking, caring, and strong doctors. I find pediatric nephrologists are incredible group of people, and so I thank you for giving this award to me. And I also accept it on behalf of all of us pediatric nephrologists, and hope that you think of all of us in pediatric nephrology and what you do when you think of me getting this award. But I really do appreciate it. Thank you.
I'm almost without words. Dr. Conley, thank you for all you do. Your steadfast empathy and compassion for the most vulnerable kidney patients, the children, is just beyond inspiring. Thank you. Kidney disease is so prevalent, and as we know, it does not discriminate. It affects men, it affects women, it affects children. In a moment, you are going to hear the almost unfathomable story of someone whose life nearly ended as a result of his kidney disease. You'll hear the story of Feji Francis and his transplant journey. While this video plays, and perhaps for just a moment or two after, I would ask that you sit and reflect on Feji's bravery, his family's agony, and a donor's unimaginable generosity. It is with those thoughts in mind that we will ask for your support, and your generous gifts will fuel NKF's life-saving programs, including the Big Ask, the Big Give Living Organ Donation Education Initiative, Keep Healthy screenings that test the risk of kidney disease, NKF Peers Patient Mentoring and Support Program, and Drive for Dialysis. Folks, in a year where the need for your generosity simply cannot be overstated, we are aiming to raise $25,000 to support NKF's programs, and I am confident we can make that happen. Any gift you choose to make is a true investment in helping the 37 million people like Feji, the countless family members whose lives are turned upside down, and the truly, truly remarkable donors who are affected by chronic kidney disease. As I mentioned, if you already pre-registered, you should be receiving a link to the site now. If not, please make sure right now you text Eve of Giving, one word, no spaces, to 76278. Eve of Giving, 76278. With all of that in mind, and candidly, because my words possibly cannot do his story justice, I give you Feji Francis and his journey to transplant.
My name is David and I'm 10 years old.
Hi, I'm Feji.
I'm Aviva, I'm 6 years old.
Hi, I'm Amy, and we're Team
Federalist. It's like a long journey. I've been feeling ill, not knowing that I was ill for a few years. So in January 2018, the knee pain was so bad, I literally took off from work, and Amy pretty much made me go to the doctor. I did blood work. Next morning, I felt good enough to go to work, so I did. the nurse from the doctor's office calls me and says, hey, you need to go to the ER right now because your kidneys are failing and we don't know why. I went to the ER, they were actually ready for me, and they looked at my blood result that my doctor had sent it to them, and they were like, something doesn't seem right. And they did them again, and my numbers were even worse. In the evening, the nephrologist comes, says, hey, sorry to tell you, you have something called polycystic kidney, and unfortunately, you are at stage 5 of the kidney disease, and only option that we have is to go on dialysis. You feel normal one day, and next day you're saying you have to go on dialysis. I'm like, I can't even comprehend. I couldn't even comprehend what that meant. You are a little scared. You don't know. I have little kids.
After their reaction at the hospital, one of the things that I did right away was just start to do research on dialysis. And we also did what we could to make our home feel not like a hospital.
I could not wait to get out of the hospital because in my mind, if you are out of the hospital, you are actually on the way to recovery. Even though knowing that the dialysis is my foreseeable future, the option of the PD dialysis was the best option for me and my family. You have this life-changing event that happens to you, unknowing to you, and you are, at least for me, I was not mentally prepared for it at all because I was completely blindsided. Amy is truly my angel. I want to thank, with her support, her taking it bull by the horn, and my kids completely understanding that I have to go through this journey, I don't think it would be possible.
So while Feji was going through his dialysis and kind of coming to terms with it, one of the resources that came through the mail was the National Kidney Foundation. And of course, we've all heard of that foundation before, but this time it really resonated with us. So I read up on what the National Kidney Foundation's mission is, and we wanted to participate. I think the biggest thing that was important to us was that the awareness initiative. We were blindsided by what was happening with Feji, and the least we could do would be to share his story and to help spread that awareness.
The amount of support that we got for the kidney walk and the NKF was overwhelming. You know, I felt like, hey, first of all, how am I so lucky? What did I do to feel loved so much? But the support that NKF, Andrea, and everybody who was through the process was amazing. The resources that you don't even think you need are available to you.
And we wanted to give back. So when we created our team Fejilicious, you know, we made our t-shirts, we told people when the date was. We did not expect over 100 people to show up that day.
I work for Citizens Bank. I'm a branch manager. My work has been tremendously supportive. They came out for the kidney walk. They all bought the shirt. Everybody donated. I think there was like almost 20, 30 people from my work itself who showed up. And they had when I say 100%, my back, they were supporting me 100%. So finding a donor, obviously my mom tried to be a donor. Amy tried to be a donor. Unfortunately, didn't qualify or match.
When we were at the hospital, I was like, in my mind, you know what? It's okay. I'm going to give him my kidney. We'll have a nice Christmas. Everything will be okay. But when I heard back and said I wasn't a match, I think that was the day that it was sad.
Yeah. So you go from this high to heartbreak in a couple hours. So a month later, it was actually Amy's birthday. I was at work. I got a phone call from the hospital saying, hey, you have a potential, you are third on the list.
We went to bed that night, phones on, we waited. I don't think either of us slept that night. And 4:30, he got this call.
I got the call. The pandemic doesn't make anybody's life any easier. But I have a hard time complaining because I literally got a gift of life in the middle of pandemic.
And as part of his welcome home, what we did was we wrote these little Post-it notes and we stuck them on the stairs, kind of as motivation, because we knew probably the hardest thing for him as soon as he got home was going to be walking up the stairs to get to his bedroom. So we put some notes on the stairs kind of to motivate him, saying, you know, you look really good, one more step, you're almost there. And one of the things that we also knew was that it was going to be really hard for him to come down the stairs in the morning. So when you come down the stairs in our house, we have a letter board. Actually, it's the first thing you see when you reach the kitchen. So we had fun with it.
After a transplant, you look back and think, oh my God, I was really sick. Yeah, I might not have realized it, but I was. You know, and you look back now and it's night and day. My outlook towards food, towards life, you know, is completely 180. I'm glad that there is an organization out there to help people for the awareness, who can hold your hand, who can help you go through the journey, even if you don't need it. You know, I'm glad there's something out there for anybody.
What an amazing story of courage and selflessness. Truly remarkable. Thank you to Feji and his entire family for sharing this unbelievable journey with all of us. So as you can see, the National Kidney Foundation means so much for the community and for families like Feji's. Whether through advocacy efforts, programs that significantly change lives on a daily basis, or through free resources for those who are already diagnosed, the NKF is there for patients, families, caregivers, and medical professionals every single day. As I mentioned, NKF's goal tonight is to raise $25,000, but between you and me, I know we can do better. You will be able to make a donation right on your cell phone by clicking the link that was sent to you in a text message. Please take a moment now to hear from a few of our incredibly generous donors about why they support National Kidney Foundation and our critical mission.
Hello. This Kidney Month, let's come together to help people living with kidney disease and spread awareness to promote kidney health.
Hi, my name is Joe Mullen. I am with Madison Apartment Group, and I currently serve on the board of directors of the National Kidney Foundation. I've been involved for about 15 years now in the National Kidney Foundation. I will tell you it's probably been the most rewarding endeavor that I've done to see the work that the NKF does, how it affects patients and families, and the programs they put together, and how impactful that has been tremendous. And as I said, it's been very, very rewarding. So I would encourage everyone at this time, please give what you can, knowing that every dollar impacts patients and families, and indeed goes to the right places. So with that, enjoy the evening and be well.
Good evening, everyone, and thank you for joining us tonight. My name is Arthur Pascarella, and I serve locally on the Board of Advisors here for the NKF. Have served since 2006, and I've been serving on the National Board of Directors since 2010. Two members of my family were afflicted by kidney disease. One was fortunate and received a deceased donor kidney, and the other one actually received my kidney in 2010, and we both are doing very well. I support the NKF as I just see the value of my investment over and over again, and I have a front row seat by virtue of my service, but they really do help others across the entire kidney risk spectrum. So I invite you to join with us tonight in supporting this great mission, and have a great night. Hope you have a lot of fun, and be generous, please, in joining with me. Thank you.
Hi, I'm Rich. This is my wife Erica, my son Mason. We're the Spencers. We want to thank you for your continued support of the National Kidney Foundation.
When Mason was just 3.5 weeks old, we had learned that he was in kidney failure. And as you can imagine, that was one of the scariest moments of our lives. And we had to reach out and find what was going on with our son through the internet. And we came across the National Kidney Foundation. We were so fortunate to have that available to us to learn about his condition going forward, so it didn't seem as scary because we were able to get real knowledge. Including times with COVID right now, they had active live sessions for our families to be a part of so that we could be able to gauge through the current times so that it wasn't as scary, and also to learn about how it could affect our own families. Without the National Kidney Foundation, it would have been extremely scary and hard for us to find the literature that we needed. And we want to thank everyone out there who supports the National Kidney Foundation and the foundation itself for supporting families like ours.
Thank you so much.
Say bye.
Bye. Thank you.
This evening I've been humbled by the generosity and support from everyone watching. I know this is not the typical way we celebrate, but tonight you have made a commitment to NKF and to the people we serve. And these funds will help save the lives of millions of Americans impacted by kidney disease. On behalf of the National Kidney Foundation, we say thank you and have a wonderful evening.